Here, the CDC is confirming the first American with a case of coronavirus through community transmission. Now, the person has no link to China, we are told. Could be exposure to another patient. That might seem kind of convoluted, but if true, it will be the first time it certainly happened with a case in this country. The NYU School of Medicine Associate Professor Dr. Devi Nampiaparampil. Doctor, I heard that, and my immediate question that I wanted to raise with you is, if one case like that is a case in the United States, it's just a matter of time before we have other cases like that in the United States and a lot more elsewhere. Then what?
Well, I think it's possible that we'll see a greater number of these coronavirus cases here. Just looking at the rate of spread, we've got over 82,000 people in other countries already that have been infected. So I think we'll see more cases. I don't think we will see the same mortality rate that we're seeing elsewhere, mainly because the deaths seem to be related to problems with the organs failing.
Yeah.
And here in the U.S., this is one of our things that we excel at in terms of ICU level care and protecting people when they have heart and lung disorders. So I think the fatality rate will be much lower. I do think we'll see other health effects. We may see people with other medical problems starting to come into hospitals, having drug shortages and other things, because as you mentioned, we rely on China in terms of our pharmaceuticals, the supply chain. So maybe we'll have shortages of other medications completely unrelated to coronavirus. And then I think also, we might see more investment in vaccines and other treatments to address coronavirus, which has an overlap with the common cold. Those are also coronaviruses, and with MERS and SARS, which are other deadly diseases. So we might actually see some advancement in terms of treating some of those problems.
Well, I've got you, Doctor. You're very good at explaining stuff to me, and I have a thick skull to get through. But I'm understanding that Health and Human Services Secretary Azar is saying a privately made coronavirus test could be sent to 93 different health labs as soon as tomorrow, pending FDA clearance. What is the timeline on that? Obviously, they're expediting things for obvious reasons, but play that out. How does that work?
Well, if that test is effective at identifying who's positive and who actually is negative, then it would be great in terms of controlling the spread of this virus. So, for example, right now, one of our difficulties is we don't know for sure if someone has the infection or not. So, for example, this person that was mentioned in California, maybe somebody else had that virus and then came into contact with him. So second, it becomes easier to identify the cases. As soon as those tests become more available to people in other laboratories so that it's much easier to test folks, I think it'll be easier to quarantine folks and to contain the virus and then control it that way.
We're waiting to hear, Doctor, from the Vice President who's sort of overseeing this. They're not calling him the czar, but he's overseeing the government efforts to respond to this. What do you think of what you've seen thus far?
I think so far the CDC has really been on top of it. I mean, with this particular case, there was a delay in testing the individual, mainly because we were focused, the country was focused on looking at people who had close contact to either someone who had traveled to China or to someone who was coming from China itself. So there was a little bit of a delay there, but overall, if you look at it, we only have about 60 cases, which in comparison to the 82,000 around the world, we really do have a good control of this. Plus, if you look at our history, if you think about other viruses we've dealt with in the recent past, Ebola, Zika, sure, they've impacted us, but for the most part, our country is really very good at controlling these types of outbreaks.
It always bears repeating, Doctor, but I think you should just remind folks of the basic things you can do at home and at work to sort of mitigate whatever's going on.
Sure. So in general, it's always better to hand wash, stay at home if you're sick, work from home, separate yourself from other folks, especially in this case, it tends to be people who are older with other medical conditions that are most at risk. So in general, take more precautions for yourself and for others, just not to spread any kind of infectious illness. But I would say at this moment, we're maybe more at risk for just various cold viruses and flu, just on a day-to-day basis for most people at home.
And as you've reminded me, Doctor, many times, far more people die of the common flu that have been hurt by this. But
exactly, in terms of the gross numbers, yes.
All right, thank you very much, Doctor. I appreciate all of that. The Vice President is speaking at the CPAC conference going on in Maryland right now. We do want to listen in here because he will likely address in his new role as sort of the overseer of all things related to this